Hello, how are you today?
Good, thanks.
My name's Sean, I'm your nursing assistant. You mind if I check your ID band?
Sure.
Alright, hi Miss Pat. Miss Pat, what I'd like to do is get you dressed in your own clothes today. Would that be okay?
That'd be great.
Alright, well let me wash my hands and gather a few things and I'll get you dressed up in your own clothes feeling better.
Great, thank you.
Alright, this time I'll go wash my hands using proper technique, and when I return, I'm going to don my gloves. Sometimes they can be a little tricky to get out of there. And now I'm going to go ahead and shut Miss Pat's door and curtain if that's okay. Miss Pat, can I shut your door and curtain for privacy?
Yes, please, thank you.
All right, you're welcome. Yeah, we're going to be having potential to expose her, so we're going to shut the curtain just to be safe. Now we're going to gather our supplies, which really just one towel as a barrier for this overbed table and whatever clothes Miss Pat wants. Miss Pat, do you mind if I go in your closet and get some clothes for you?
No, not at all.
Okay, what kind of clothes would you like? I think what you have in here, let me tell you what you have. You have a blue shirt with yellow stripes, some sweatpants, and it looks like you have some denim and another pink shirt. What would you like?
That would be fine, the blue shirt and the blue sweatpants.
Okay, all right. And let's see, I see some socks right here. Okay, so I'm just going to set everything out and get them ready. All right. And we'll do the shirt first. Okay. So let's see here. All right, Miss Pat, you have a weak right arm, so I'm going to go ahead and undress your strong arm first, and then let me just cover you up a little bit so we don't expose you. So with an affected or weak right arm, we're going to undress the strong arm first and dress the strong arm last. So we like to say start strong, finish strong as a reminder. All right, Miss Pat, I'm just going to unbutton your gown here. And we're going to get this shirt on for you. Okay, I'm just going to assist you to sit up a little. There we go, and I can untie this. So this is where these hospital gowns come in super handy because they do unsnap. So I've got this side unsnapped and it's not under Miss Pat, so we don't want to cause any friction or shear. When you pull the linens or the clothing, it can shear the skin. Okay, so here you might be able to see how I'm going to unbutton this so Miss Pat doesn't have to move a whole lot while I get this off. And this is Miss Pat's weak arm, so I'm going to support it off of the bed. Okay, Miss Pat, how are you doing?
Good.
Okay. I'm going to make sure that this is not under her either. I'm going to go ahead and pull this gown off under the sheets, rolling it in on itself. Okay, Miss Pat. We'll keep you nice and covered up. So, if we're going to start strong, finish strong, we can place this in the linen hamper. We're actually going to dress her weak arm first. Now, one thing that'll help when we dress her is if we sit her up, because getting the shirt behind her and she's not real strong will be very difficult. Miss Pat, do you mind if I sit the head of your bed up?
No, not at all.
All right. You doing okay?
Yes, I am.
All right. All right. Okay, Miss Pat. It's a nice shirt you have here.
Well, thank you.
Some of my favorite colors. All right, so we're going to go ahead and bunch up this sleeve so I can place it on Miss Pat's affected arm or weak arm. See if I can get over here where you can see. Okay. gentle. And alright, I'm going to support Miss Pat's arm and pull this sleeve right on up. While I'm here, I can go ahead and button this, but I'm going to leave it just in case I need a little bit of extra room, because it's difficult to dress a mannequin, in all honesty. They're not as pliable as humans are. So I'm going to leave that unbuttoned for now. Miss Pat, I'm going to help you sit up at the count of 3, okay?
Okay.
All right, 1, 2, and 3. Alright, I'm just going to tuck this shirt behind you. There you go. Now we want to make sure that we don't have a lot of wrinkles or anything for her to lay on, because that can cause skin breakdown. You doing okay, Miss Pat?
Yes, I am. Thank you.
You're welcome. And we can use this shirt and cover her up underneath. Okay. Alright, so again, like I said, we're going to start strong, finish strong. So we undress the strong arm first, and we're going to address the strong arm last. Now again, I can bunch this, use the bunch technique. And this is the hardest part of dressing the mannequin, is getting their second arm in. Because again, they are not as pliable as as real humans are. They're pretty rigid, actually. Even the nice ones like Miss Pat. She was a really good mannequin. All right, Miss Pat. You doing okay?
Yes, I am. Thank
Okay.
you.
Oh, you're welcome. So you want to always support the arm. And there you go. So I'm going to assist Miss Pat to sit up one more time. Sorry about that, Miss Pat. Miss Pat, I'm going to assist you to sit up one more time and just adjust this shirt behind you. Would that be okay?
Yes, of course.
Okay. Here we go. All right. 1, 2, and 3. Okay. All right. There you go. How you doing?
I'm fine.
Okay. Sometimes exposure is going to happen. You just want to try to minimize it and do the best you can. That's why we have the curtains and everything closed. All right, Miss Pat, I'm just going to fold this blanket down a little bit and go ahead and button your shirt, okay?
Okay.
All right. Do you like your very top button buttoned?
No, not the very top one.
Okay. Okay, well, I'll start the second one down. Would that be okay?
That's perfect. Thank you.
You're welcome. All right. And you want to make sure that every button is fastened and every fastener is fastened. If it's a tie, tie it. If it's a snap, snap it. If it's a fastener, fasten it. If it's a button, button it. Okay, so I'm going to go ahead. All right, Miss Pat, how are you feeling there? You look good.
Thank you. I feel nice and comfortable.
Okay, so I'm going to go ahead and button the sleeves at this time. Alright. And I'm going to cover Miss Pat up too, because we're not quite done yet. And I'm going to come over to this other side and button this other sleeve, because I don't want to forget it. So if I don't button it now, I very well might forget it. Okay, Miss Pat, that's your shirt. So let's get your socks and everything on. I'm going to move this off to the side, and I'll show you my technique. I like to work down at the bottom of the bed so we can expose her feet. Miss Pat, I'm going to place some socks on, okay?
Okay.
Now, it's only her right upper extremity that's affected and weak, but in case her right lower extremity is as well, I'm going to go ahead and dress this one first. But for testing purposes, it's only the right upper extremity. So we're going to bunch the socks like so, start them around the toe, and just roll them right on up. All right, Miss Pat, how are you doing?
I'm good, thank you.
Okay, all I need to do is put on your pants and we're all done.
Okay.
Now the pants, what you can do is bunch bunch the leg up the same way. Okay, and I'm going to place the right side on first, like I said, just in case. A lot of times when patients have strokes or residents have strokes, it affects their right upper and lower extremity. But in this case, she's okay. Her lower extremities are fine. But I'm just going as a creature of habit now. All right, Miss Pat. Okay, so this is the tricky part where there's a couple techniques. You can come from the bottom and push up, or you can come onto the side and work up. And I like to do it this way, okay? And the sheets and covers will come up with the as you pull the pants up, so there's very minimal exposure. All right, Miss Pat, I'm going to pull your pants up real quick.
Okay.
All right, how are you doing?
I'm good, thank you.
Okay. All right, Miss Pat. Now these joints on a mannequin are very tricky. They have cracks and crevices, and your clothes will get caught up in them. All right, Miss Pat. Okay, your pants look nice. I'm going to go ahead, and there's a tie on these pants. I'm going to go ahead and tie them. If there was a zipper or button, I would zip or button it. Okay. All right, Miss Pat. Now let's go ahead and make sure our clothes look neat. Okay. Boy, you look good, Miss Pat.
Thank you.
All right. Would you like your covers up again?
Yes, please.
Okay. Could I lower the head of your bed? It looks like it might be a little bit high.
Yes, thank you.
Okay. All right. Tell me when.
That's better.
Good? Okay. All right. All right, Miss Pat. Let me just get your cover straightened again. Now, neatness does count. Obviously, we're not going to be able to get the bed perfect in the short amount of time we have to complete this procedure, but we can get it nice and neat where Miss Pat feels better, and if she has visitors, she won't be embarrassed that everything is such a mess. All right, Miss Pat. Now, with her right side being weak and affected, I wouldn't really want to put the call bell there. So I'm going to give her her call bell and place it in her left hand. Miss Pat, here's your call bell if you need me.
Okay, thank you.
You mind if I open up your door?
No, not at all.
Okay. How do you feel? You feel a lot better being in your own clothes?
I do.
All right. So let's see, I'm going to do my post-procedure check. The door's open, the bed's in its very lowest position. I've already adjusted Pat, the head of her bed, to her comfort level. She has her call bell. All her buttons are buttoned, all her fasteners are fastened. So everything looks good. Okay, Miss Pat, if you need me, you give me a call, okay?
All right.
All right, this time I'm going to deglove, go wash my hands, and come back and announce to the evaluator, end of skill.